In 1982, 7 people died from cyanide-laced Tylenol in Chicago. Johnson & Johnson responded with full transparency, recalling 31 million bottles, over $100 million of inventory, and creating the first tamper-proof packaging standards. That decision set a new bar for corporate responsibility. 4 decades later, as AI transforms healthcare, federal policy is trending in the opposite direction. Adam Mosseri, the head of Instagram, recently argued that authenticity is becoming infinitely reproducible. When AI generates content indistinguishable from reality, trust changes fundamentally. Technology commentator Shelley Palmer calls the idea that imperfection proves authenticity as adorable fantasy. AI can fake imperfection too. Both agree on one point. We must fingerprint authentic content rather than chase endless fakes. But where do we draw the line between acceptable AI tool use and excessive AI generation? If industries focused on entertainment and social media struggle with this question, how much more critical is it when patient lives are at stake? Healthcare AI hallucinations, outputs generated by statistical probabilities but ungrounded in clinical reality, pose risks far greater than a misleading social media post. A diagnostic system might identify patterns that don't exist. A documentation tool might generate fictional patient histories. A treatment recommendation system might suggest therapies based on non-existent evidence. Each scenario threatens the fundamental trust between patients and caregivers. Yet at this critical moment, federal policy is retreating from the oversight patient safety requires. The administration proposed eliminating disclosure requirements for AI tools used in patient care. Executive orders have weakened safety guidance and created task forces to challenge state-level protections. The burden of vetting AI now falls squarely on healthcare organizations themselves. The European Union offers a contrast, classifying healthcare AI as high risk and requiring transparency, documentation, and mandatory human oversight. But regardless of where policy lands, the core principle remains. AI must augment, not replace, human clinical judgment. Clinicians are positioned to identify problems, question recommendations, and apply expertise when AI outputs seem implausible. They must be active partners in maintaining system integrity, not passive consumers of algorithmic output. When Johnson & Johnson faced its crisis, they understood that the long-term value of public trust far outweighed the short-term cost of transparency. Healthcare organizations deploying AI must embrace the same calculus, even when federal policy no longer requires it. Trust is what keeps healthcare moving forward.